Hello and welcome to Understanding Psychology with Alex. Today we look at ways of dealing with depressive phases and depression according to different studies. Traditionally, depression has been treated most of the time with medication instead of other forms of therapy, such as cognitive-based therapy, for example. Today though, we will look at different ways of dealing with depression based on scientific studies. First, the cognitive behavioral therapy, on which I've already created a short informative video. If you've not seen it, go check it out. The cognitive behavioral therapy, also referred to as the gold standard of therapy, is an alternative to therapy style to traditional medication therapy. One of the main goals of CBT therapy is to equip the patient with the necessary tool to take care of oneself for a long time, essentially making everyone their own psychologist. The effectiveness of CBT has been shown in various studies examining the effectiveness of different forms of therapy in psychotherapy. Next, the psychoanalysis and psychodynamic psychotherapy is a form of therapy in which the therapist tries to uncover the roots and the origin of the depression or depressive mood. This way, the patient will get an understanding of their own depression and, most importantly, why they feel the way they do. The psychodynamic psychotherapy has been shown to be effective, especially long-term, according to a study conducted over a time span of 15 months. Further, there are multiple types of short-term therapies that can help significantly against depression or depressive mood. For example, short-term therapies include the acceptance and commitment therapy, the emotion-focused therapy, the interpersonal psychotherapy, and the behavioral activation therapy for depression, to name just a few. All of these have various different studies displaying the effectiveness of each therapeutic style. Another way of dealing with depression, which does not necessarily involve other people, is physical and mental exercise. Especially the antidepressant effect of serotonin produced by physical exercise can be of help for one or the other dealing with depression. In fact, a too low amount of physical exercise can lead to a heightened chance of experiencing depression. Also, meditation and mindfulness-based trainings can be an effective help when it comes to battling depression. Recently, it has been shown in a study that mindfulness-based treatments can have the same or similar effects to cognitive behavioral therapy, making it a viable alternative to battle depression. Mindfulness and meditation help in a way of not letting your mind wander off and create scenarios which lead to a subsequent depressive phase. The last method, and the most traditional one, about which I will not speak in detail as it has not much of an interest to us, is the medicative therapy or approach, in which medication is used either by itself or combined with other forms of therapy. I hope you could learn a new way of dealing with depression or depressive moods and enjoyed this video. Thank you for listening in to Understanding Psychology with Alex. Feel free to subscribe to the channel if you would like to see more of these videos in the future. I'm still working on my overall quality of production and content, so please bear with me. It will become better eventually in the future. Have a great day. Goodbye.